Bright lights are headed towards you. They come closer and closer. Your adrenaline has just risen, and in an instant your body collides with the glass that is now shattered into a million pieces. You catch a glimpse of blood running from your body. You want to scream in pain, but you are in such shock that you can't project any noise. You have just now been in a car accident, and even if they get you out alive, you still need units and units of blood just to survive. Because of accidents like this, I help run the local blood drive with my mother. I have also donated my own blood in hopes to help another person. I hope to persuade you as my audience to also donate blood to save people that get in similar accidents that I have just previously described. Today, I will urge you to donate blood because the need for it is crucial. It is healthy for you as a donator, and it is also the morally right thing to do. First, I'll begin by explaining the need for blood. Our nation in general has a major blood shortage. One reason is because of tragedy. The National Highway Traffic Safety Administration estimated that 32,310 people died in just motor vehicle crashes in 2011. Blood transfusions may also need blood during surgery. Some people may lose too much blood, and so they get a donator's blood to replenish what is lost. The Red Cross president, Dr. Bernadine Healy, says a single car accident victim can require 100 units of blood. The increase in demand far outpaces the increase in blood donations, with donations increasing annually by 3% and demand growing faster at 6%. 60% of the population will need blood at some point in their lives, yet only 5% of the population donates. Another reason is because there is no substitute for blood. Trials have been made to experiment with substitute blood, but have only found that it increases death rates by 30%. Substitute blood has also been found to increase the risk of heart attacks. Charles Nathanson, a critical care specialist at the U.S. National Institutes of Health Clinical Center, isn't in favor of shutting down the research. He says, "We need to move from humans back to animals until we find a formulation that has less toxicity." The shelf life is also another reason. Even the people that donate, blood can only last on the shelf for 35 days. With such a quick expiration date, blood is needed more than we even think. Blood can only be frozen up to a year, but then it must be discarded. Donating blood is not only healthy for the victim, but also for you as the donator. It is a good checkup for your vital signs, which include temperature, pulse rate, respiratory rate, and blood pressure. Your temperature should be at 98.6 degrees. If your body isn't at 98.6, this means your body is trying to fight off an infection. Your pulse rate should be at 60 to 80 beats per minute. If it is higher, this could result in a tachycardia or that the heart isn't getting enough blood. Respiratory rate should be 12 to 18 breaths per minute. If it is higher, this means your body isn't getting enough oxygen and could result in a heart attack. Blood pressure, which is the force exerted of blood through the artery, should be 120 over 80. If both numbers are higher, this could mean coronary heart disease and stroke. If they are low, it's not as severe unless the drop in blood pressure is sudden. This could also be a good check for iron and cholesterol. Men are susceptible to getting hemochromatosis, or in other words, an overload of iron. An untreated iron overload can lead to the damage of the liver, arthritis, skin discoloration, and diabetes. With just a simple check, this could all be resolved. Cholesterol is a waxy substance that travels through the arteries. It can build up in your arteries and lead to heart disease. Along with it being good for you, it is also the general right thing to do. Our body has blood to spare. Our bodies can spare blood because immediately after donating, the body works on restoring the blood donated. Fluid is also stored in the tissues and returns to the bloodstream. This boosts the red blood cell production. A pint of blood donated could be restored within only a few hours. You will also become a hero to someone. Just 1 pint of blood can be separated into 3 parts, which can save several people. Red blood cells are 1 part. They carry oxygen to the body, and this is mostly needed for car accident victims and surgery patients. They can be stored up to 42 days. White blood cells, or plasma, These cells are 90% water and 55% makes up the blood volume and helps the organs, burn patients, and shock patients. It can be stored up to a year. Platelets. These cells are important for blood clotting and gives cancer patients hope. They can only be stored at room temperature for no longer than 5 days. Hopefully now I have helped you to understand how necessary blood is. In conclusion, I hope that my speech has persuaded you to donate and that you understand the need for blood, how it is healthy for you, and also morally the right thing to do. I hope that next time a blood coordinator calls you asking if you will donate, you will seriously consider it.